You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. My first guest is Dr. Matilde Castellini. Dr. Castellini is the founder of Orlando Advanced Cosmetic Dentistry and TMJ. We've invited her on the program today to discuss TMJ and its relation to headaches. Dr. Castellini, welcome to the program.
Thank you for inviting me, Randy. It's a pleasure to be here.
Now, before we get into today's topic, tell us a little bit about your practice. What type of patients do you see?
We see your general patient that comes to the practice for checkups, and also the ones that are being referred by practitioners with headaches and migraines. But mainly people who need general checkups, fillings, everything. Your regular patient, they come into my practice.
Now, a lot of patients come to you because they're in pain, and by reputation, they see you. Is that correct?
Well, actually, they come to the practice when they come referred by the physicians. Of course, they're in pain. But the majority that come to my practice, they don't know that I can help them with headaches and all the problems that they have. So it's really a surprise when they get into the practice that I can help them. And usually what we see immediately, they come in and they're looking for someone who's going to fix their fillings or their root canals or whatever they need. But I start looking at the patient, and immediately I start noticing different signs in their faces. Muscles are contracted, grinded teeth that are being grinded by bruxism, which is the grinding of their teeth, and different symptoms. And they're surprised when I ask them if they have headaches. Immediately they say, yeah, how do you know? I said, well, I can see your face.
So is that in some cases something you could turn around?
Yes.
The headaches?
Definitely.
And they go away?
Yes. Oh, yes.
Okay.
Definitely, but they don't know. Because usually when you have a headache or you have any problems, you usually get accustomed to that. And you can always attribute that to different things that you do, like maybe you're exercising too much, or maybe you are not sleeping or working too much on the computer, and then you take an Advil and it will go away. But there's something more.
So there's a connection.
There's a connection, and there's something that the patient should know, your audience should know about, that it's not normal to have headaches at all.
Okay. Now, your training, you are one of about 200 dentists that have graduated with LVI, Las Vegas Institute.
Yes.
You call yourself a neuromuscular dentist. We were looking for a TMJ expert, somebody that dealt with pain, headaches, and that relationship, and your name came up. Tell us about your training.
Well, I was always interested in temporomandibular joint and headaches. And when I was doing my fellowship at the University of Florida, I came across different way of treating patients with that type of problems. And that was back in 1985. So I was always interested in that, in that part of dentistry, which usually is very mysterious in dentistry. For some reason, nobody has consensus of what is it and how it should be treated. Then when I actually went to LVI, I went to LVI to really become a cosmetic dentist, to do postgraduate work on cosmetic dentistry, which I graduated from the Institute. I finally find something that it clicked. It really makes sense to me. And that's
which was the neuromuscular part of this.
Yeah, the neuromuscular part of dentistry, which is a different way of treating the patient rather than your traditional way of treating the patient.
You told me on the phone, you said, Randy, someday all dentists will be neuromuscular dentists.
I totally believe that.
You believe that?
I believe that because it really makes sense. It's really something, and it's not only because we say so. It's because the patient gets better without any medication. I mean, there's a consensus that the best treatment should be the one that will resolve the problems without being invasive and being conservative. And what we do is actually that. We resolve the problem with the patient without being aggressive or doing surgery or giving them a lot of medications.
What does neuromuscular mean?
It's the technology that helps align the joint, the temporomandibular joint, to the bite, the teeth, by relaxing the muscles into a physiological position.
Okay.
So it's like a triad of 3 different things.
Now, today's topic, headaches. It's a show about headaches, how to remove them and their connection with the TMJ. Help me understand, let's talk about the symptoms, because I asked you on the phone, anticipating this interview, the TMJ was really just about jaw pain. You say it's not. So tell me about some of the symptoms.
Most of the people don't realize that that temporomandibular joint is what we call the great imposter. And this is why so many times it goes misdiagnosed.
So where is this joint?
The joint, this is the joint. This
Just
is the only,
the jaw.
this is the jawbone with the temporomandibular joint that connects the jaw to the cranium. Okay. So what it is that it will give you some, when that system is not healthy, it will give you symptoms that you don't really think have to do anything with the vital of the joint.
So you could be like migraine headaches, for example.
Like migraine headaches.
Can be associated there.
It could be associated to that. And not only that, you could have ringing in the ears, tingling hands, neck pain, headaches, teeth are sensitive, dizziness, vertigo. All of those symptoms are mainly related
and connected,
and also a misaligned bite, because it's such, everything have to be in balance. Okay.
So you're using technology, and I took some notes when we talked, to find, as you say, a happy place
of the muscles.
Of the muscles for the bite.
For the bite.
And then their headaches go away.
And then the headaches go away. Exactly, just like that.
Is that right?
Is that right? Well, this is. Let me just make you believe that you're my patient. This is what it is. So you just come in, we do the examination, and we start talking about, you're not referred by a physician, you don't even know that I can help you with your migraine headaches.
I'm coming to you for something else.
Yeah, and actually I have a patient that I brought a picture, I mean not a picture, a video, that he came in to the practice because he wanted to have all his teeth extracted. And all of a sudden, I said, well, I cannot. And he was mentioning that he has migraine headaches for 25 years, or 20 or 25 years. And I said, well, not only I can fix your teeth and keep it, but I can also get rid of your headaches. Well, they said, well, they just don't understand it. So we go and do the examination, and we tell them how many cavities, whatever it is. And then if they're interested, they will have a consult. In that consult, that's where I will present to them how a neuromuscular dentist will treat them.
Okay.
Which is different from your traditional dentistry.
So the person with the 25 years of migraine headaches, went away?
Well, he came back, of course, immediately. Okay. So what we did is we went through the whole process, because the treatment consists of 2 phases. The first phase is to make sure that he doesn't have any underlying problems. It could be that he has a brain tumor, so we refer them to the physician, so they will go over, or it could be some problem in the ear, so we refer them to the ENT to make sure that they don't have any other issues. If they come back and nothing is showing that they have any problems, then definitely we can help them. And what we have is computerized technology that will help us read the muscles into all different type of technology, like sonography, electromyography, jaw tracking, that is going to help us determine where the muscles are supposed to be. Because it's a problem about muscles. If the muscles are contracted and are not happy, and in tension, they will always be in pain.
Do you have stories, or miracle stories, where people that had headaches, migraine headaches, their entire life, and after a few treatments or whatever that you do, they're gone? I mean, is this once a week, every week?
Yes. Oh, definitely. That's why I'm so passionate about this. That's why I'm on TV. Okay. Believe it or not, I'm a shy person.
Is this your role, though, as a dentist, to be treating headache problems?
It's my calling. It is my calling. And let me tell you, I enjoy doing cosmetic dentistry. I love it. But there's no better and more rewarding thing to have someone really that being in pain all their life, taking huge amounts of medication, still the same, and they come to my practice and we're able to help them.
Now you mentioned traditional dentistry. Okay, so somebody goes in with a TMJ problem or migraine headaches, things like that. How does traditional dentistry differ from what you're doing as a neuromuscular dentist? I
think traditional dentistry is like all of us. What we want to do is help the patient. So they're doing an excellent job. And what I train in the university, I think they have a fantastic school of dentistry that is really helping a lot of people. But where we differ, and this is something that you need to understand, there is no consensus in the profession of how to treat the temporomandibular, and before I continue, I'm sorry, because TMJ is a catch-all term.
Okay.
The proper name should be temporomandibular TMD.